Welcome to Mihiraa's English Listening Test for Healthcare Professionals. Sample Test 1. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. 4 questions, 1 to 24. Complete the notes with the information you hear. Now, look at the notes to extract 1. Extract 1. Questions 1 to 12. You hear a physiotherapist talking to a new patient called Mihiraa. 4 questions, 1 to 12. Complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come in. It's Mrs. Mihiraa, isn't it?
That's right. I'm Mihiraa.
Now, I think you've been referred to me because you're suffering from tennis elbow.
That's right. It's been for a while actually.
Okay, well Mihiraa, I've got some notes here. Perhaps it will be better if you can divulge in your own words about your previous bouts of tennis elbow you've had.
Righto. Well, it started 3 months back now. I started to experience some pain in the right forearm muscles while playing cricket. You know, I am a right-hand batsman and captain of the Leicester Cricket Club. I took sit out for the last 2 series. But I need to get it fixed before the County Cricket League, which starts next month 19.
And what you did so far?
Well, in the first instance, I was given opiates, obviously, ibuprofen, as far as I remember, and I was told to put compression packs on the affected area. I mean that did ease the pain a little, but I was still housebound practically speaking.
I see. And your GP said it is tennis elbow?
Yes.
It's okay. Well, any changes afterwards?
Not specifically. I had this pain in the forearm muscles, which attached to the outside of my elbow. I got retired hurt in the finals against Manchester City. I need a quick fix and don't want to spoil this season.
Okay. All right. At first, you may have pain, burning, or soreness along the outside of your forearm and elbow. With time, the pain gets worse. If you continue the activity that caused your condition, the pain may spread down to your wrist, even at rest. Pain may also persist when you place your arm and hand palm down on a table, and then try to raise your hand against resistance. You may also feel pain when you try to lift and grip small objects, such as a coffee cup.
So, what you are trying to convey?
It's important to avoid the movement that caused your sprain in the first place.
So, what happens if I play this season?
Mihiraa, lateral epicondylitis, or tennis elbow, is swelling or tearing of the tendons that bend your wrist backwards away from your palm. It's caused by repetitive motion of the forearm muscles, which attach to the outside of your elbow. The muscles and tendons become sore from excessive strain.
Now, tell me, what's next?
I see. An EMG may be done to look for nerve problems. Alongside, it can be treated with rest and medicines to help with the inflammation. Exercises often help too. Rarely, surgery may be done to repair the tendon.
Don't talk to me about surgery at this point in time. I hardly have days to start practicing with my team.
You can help prevent tennis elbow by doing things like warming up before exercise or sports, increasing activity slowly, using the right equipment for activities, and strengthening your arm muscles.
Ah, that's fine. Then?
Get rest and manage pain and swelling. Let me know if these strategies don't help reduce pain, swelling, and loss of function.
Will it get a much deeper problem?
Well, Mihiraa, I couldn't say for certain, because it all went on for 3 months without much improvement really. So to be honest with you, I think a combination of therapeutics gradually will take effect and come together rather than one single thing making the difference.
Okay, I see.
Okay, and let's see how the problem continues during the season and can make symptomatic management.
Alright, that's fine.
Extract 2. Questions 13 to 24. You hear a consultant ophthalmologist talking to a patient called Mihiraa. 4 questions, 13 to 24. Complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Miss Mihiraa, please come in and take a seat.
Thanks.
Okay, now, I understand from your GP that you've got a perpetual headache.
Yes, doctor. I went to see him a couple of weeks ago because of a shallow but continual headache, which I haven't had before. You know, it appears, and then it stays and stays. It's here on the entire forehead. He wasn't sure what it was, so he said I'd better see an ophthalmologist first. Didn't he tell you about it?
He did, yes. He did. So. Yes. So tell me a bit about the triggering factor of your condition.
Well, I am an IT professional. Long hours of working with a computer are unavoidable. After I initiate my work in the morning, a few hours later, I get started with a small pinching ache. It then gradually gets bigger and endures.
Okay.
When I showed this to the doctor, he said it was eye strain. Anyway, now you can have a check.
Mihiraa, while you might think the act of focusing on a screen is a straightforward process, it's not as simple as it sounds. The distance between the front of a monitor and our eyes is called the working distance. Interestingly, our eyes actually want to relax at a point that's farther away from the screen. We call that location the resting point of accommodation up here.
Okay.
In order to see what's on the computer screen, the brain has to direct our eye muscles to constantly readjust focus between the RPA and the front of the screen. This struggle between where your eyes want to focus and where they should be focused can lead to eye strain and eye fatigue, both of which can trigger a headache.
But it's my livelihood. What about the treatment?
Well, Mihiraa, most cases of computer-related eye strain do not require medical intervention, but can instead be alleviated by adopting new prevention practices. To reduce computer screen-related eye strain, follow the 20-20-20 rule endorsed by the American Optometric Society. Every 20 minutes, simply stop and take a 20-second break to view something 20 feet away. Moreover, it's a good idea to rest your eyes completely for 15 minutes after 2 hours of continuous computer use.
Alright, let me put it into practice.
Okay, well. Yep, that all looks absolutely fine. Well, I don't think you need to worry about anything seriously.
Do I need any glasses?
Yes, Mihiraa. Obtain regular eye care. While you may not need eyeglasses for everyday activities, you can benefit from wearing prescription glasses when using your computer.
Sure, I will. What do screen headaches feel like?
Actually, Mihiraa, It can vary. It might feel like a sharp pain or a dull ache. If a migraine is triggered, you may feel severe throbbing pain on one or both sides of the head. Poor posture when using a screen may cause a headache that starts at the base of the skull and goes up one side of the head.
Oh, I see. And do blue light glasses stop screen headaches? Should I be covering the place up?
No. No. You don't need it. Research shows little evidence that those glasses can reduce eye strain and screen headaches. While a 2021 study found blue blocking lenses had no benefit for eye strain, there were no adverse effects reported from wearing them.
Oh, I see.
One last thing you should follow is your posture. Position your keyboard and computer so that your head is not tilted and your spine is neutral. The center of the screen should be about 4 to 5 inches below eye level and 20 to 28 inches from the eye.
Okay.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now, look at question 25. You hear a trainee nurse telling her supervisor about a problem she had while carrying out a procedure. Now read the question.
So, how's today gone, Mihiraa?
Well, I'm afraid I had a problem inserting a catheter for Mr. Jones. I've done it procedure several times now, so I wasn't particularly nervous. What I hadn't anticipated was the difficulty of passing the catheter through the urethra. I suspect his prostate gland is enlarged, which is common in older men, and that's caused some obstruction.
Well, that can happen with male patients. And it's painful for them if the procedure isn't done smoothly.
Oh, he was very patient and cooperative. I'm sure I would have complained in similar circumstances.
Well, I'll supervise you the next time you do it.
Question 26. You hear a doctor explaining a diagnosis to a patient. Now read the question.
Now, Mihiraa, a quick word about your condition. You have been diagnosed with rheumatoid arthritis, which is a chronic inflammatory disorder that affects your joints. It's great to see that you have been following the treatment plan and, thanks to this, your symptoms have improved significantly. The tests we've done also reveal some interesting findings, like your inflammation markers being lower in the morning than in the afternoon or evening. We're not sure why, but there's a clear pattern. Also, we know that being stressed or anxious for any reason can worsen your condition. So, please try and avoid any situations that might trigger your negative emotions. Finally, we must be on the lookout for any side effects of the medication, such as stomach ulcers, infections, or liver problems. Fortunately, we haven't seen any signs of these complications in you, but the treatment for rheumatoid arthritis can be quite aggressive.
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Mihiraa, could you start us off?
Sure. We have John Smith in bed 7. He's a 32-year-old male who was brought into the emergency department by ambulance overnight. He has a history of bipolar disorder and substance abuse. He presents with acute mania, agitation, and aggression. He's to remain in high-dependency unit care until the stabilization of his mood and behavior. We'll be observing him every 15 minutes and monitoring the level of his risk, impulsivity, and any response to interventions offered.
Okay, I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Psychiatric intervention is required for medication review and psychoeducation, and that's being booked for tomorrow. Also, an application for a community treatment order may be required.
Right. We'll consider that at tomorrow's ward round.
Question 28. You hear part of an ear examination at an ENT clinic. Now read the question.
Ms. Mihiraa, how can I help today?
Well, I just wanted to check something.
Okay, so, you're having problems with your balance?
Yeah, though everyone says it's just a minor issue. I've been feeling dizzy and nauseous for the past few weeks, and sometimes I lose my balance and stumble. I'm worried that it might be something serious, like a brain tumor or a stroke.
An ear problem is more likely, I'm afraid, because your ears play a key role in maintaining your balance. They have fluid-filled structures called the vestibular system that sense the movement and position of your head. They send signals to your brain that help you coordinate your eyes, head, and body movements. We'll do some tests to see if there's any problem with your vestibular system. But I wondered if you have any other symptoms, like hearing loss, ringing in ears, or ear pain.
Yeah, I have some hearing loss in my left ear, and sometimes I hear a buzzing sound.
A hearing test is out, I'm afraid, 'cause we can't do it without an audiologist. Just a physical exam and some balance tests. But they're very effective in diagnosing your problems.
Yeah, a physical exam sounds good.
And you had a cold recently.
Yeah, I had a runny nose and a sore throat, but it went away after a few days.
Well, that could be related to your balance problem, as a viral infection can cause inflammation in your inner ear.
Question 29. You hear a physiotherapist talking to an elderly woman who has a stiff knee. Now read the question.
Now then, I understand you have been having some trouble with your left knee, is that right, Mihiraa?
Yes, it's been bothering me for a while. It feels tight and sore, especially when I walk or climb stairs. My doctor says I have osteoarthritis.
You've certainly got some signs of wear and tear in your joint, but I don't think your doctor's diagnosis is complete. Does your knee make any noises?
Well, sometimes it clicks or grinds when I move it.
Right. Well, I suspect you have what's called patellofemoral pain syndrome. It's the common condition that affects the cartilage under your kneecap. It can cause pain, stiffness, and cracking sounds in your knee. I can't see any other problems, but you'll need an MRI scan to see how much damage there is. If it's severe, you might need surgery to smooth out the cartilage, but let's hope not.
Oh, dear.
Question 30. You hear a nurse briefing her colleague about a patient. Now read the question.
Ms. Mihiraa was admitted last night for chest pain. She came in yesterday with a history of coronary artery disease and hypertension. She's a smoker and has a family history of heart disease. She's on a cardiac diet and has a penicillin allergy. She's at high risk for cardiac arrest due to his condition. We started her on nitroglycerin and aspirin, which she's tolerating well. Her assessment is within normal limits, except for some occasional palpitations and angina. Her vital signs are stable, her oxygen saturation is 95% on room air, and she's been resting during my shift. Around 6.00, I gave her 1 morphine for moderate pain, with good results. She has a 20 gauge in her right arm. She's got normal saline at 10 mils per hour.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now, look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with a cardiologist called Dr. Mihiraa, who's an expert on Zika disease. You now have 90 seconds to read questions 31 to 36.
Today we have the privilege of speaking with Dr. Mihiraa, an infectious disease specialist and Zika fever expert in the Asia Pacific. Dr. Mihiraa, could you explain to our audience what Zika fever is and why it's often referred to as an overlooked disease?
Zika fever is caused by the Zika virus, which is primarily transmitted through the bite of infected Aedes mosquitoes. Many individuals contract the virus without realizing it, and during the initial stages of infection, symptoms are generally mild, or may even go unnoticed. Fortunately, the majority of those infected, around 80%, experience no significant complications. However, the remaining 20% may enter a latent phase that can last for several years, before progressing to more serious neurological and developmental disorders. Despite affecting millions of people globally, Zika fever receives relatively limited attention and research funding. This is largely due to the fact that it mainly affects people with low socioeconomic status, who have limited access to healthcare, education, and sanitation in regions, particularly in parts of Africa. Cases of Zika fever in humans were reported only sporadically in countries in Africa. A small number of cases also were reported in parts of Asia and Indonesia. As with any disease, raising awareness and garnering resources are crucial to instigate substantial efforts against it.
I understand the context better now. Are there any concerns or cases of Zika fever in the Asia-Pacific?
Absolutely. The emergence of digital social networking has created a greater awareness of the potential consequences of the disease. While the Aedes mosquitoes that carry the Zika virus are endemic to certain regions of the southern Asia-Pacific, the number of confirmed Zika fever cases has been relatively low since its emergence. However, there is a notable concern related to travel and immigration from regions where Zika fever is prevalent, may unknowingly carry the virus with them. It's estimated that approximately 200,000 to 300,000 people may have been exposed to the Zika virus. Although these individuals are unlikely to transmit the virus to others, there is a subset that could experience long-term health issues.
Could you provide us with an example of a specific Zika fever case?
Certainly. Just recently, a young woman, let's call her Mihiraa, a Royal Health Club member, approached me for Zika fever testing. She had been residing in Europe for a number of years, but had recently traveled to a Zika endemic region, and fell ill shortly afterward. Initially, she attributed her symptoms to travel-related stress and changes in her routine. Coincidentally, Mihiraa had contemplated donating blood, but voiced her concerns about her health to one of her club members. Eventually, upon hearing from her clubmate that Zika fever could be transmitted while traveling to countries where there have been outbreaks, Mihiraa sought medical advice to ensure her future family's well-being. Tests confirmed that she had an active Zika virus infection at an intermediate stage.
That's quite enlightening. What challenges can arise when treating Zika fever?
One patient, whom I'll refer to as Alex, faced some unique challenges. Following a vacation to a Zika-affected area, Alex began experiencing symptoms consistent with the virus. Tests indicated Zika virus presence, and Alex was referred to my clinic for further evaluation. Struggling with anxiety, Alex researched Zika fever online, becoming understandably distressed by the potential consequences. This emotional turmoil was compounded by apprehensions about the main treatment option, as antiviral medications can have significant side effects. Ideally, treatment is most effective if administered within the first few weeks of infection, but due to the time elapsed since the probable exposure, the window had closed. Nevertheless, Alex decided to undergo treatment with antiviral medication and thankfully experienced no adverse reactions.
Do you also deal with patients in the later stages of Zika fever?
Yes, I've had the opportunity to work with patients like Sarah. She was diagnosed with Zika fever several years ago, and subsequently developed persistent neurological symptoms. Had Sarah been diagnosed and treated earlier, her long-term prognosis might have been more favorable. Over time, her condition further deteriorated, leading to challenges such as movement and cognitive issues. While there is no definitive cure for Zika fever, managing symptoms and maintaining a healthy lifestyle are key recommendations.
Thank you for sharing these insights. Moving forward, what strategies can be employed to combat Zika fever on a broader scale?
There are several avenues that researchers and public health experts are exploring to combat Zika fever. One crucial area of focus is the understanding of the molecular mechanisms of Zika virus infection and its effects on the nervous system. Zika virus can cause severe neurological complications, such as microcephaly in infants, Guillain-Barré syndrome, and encephalitis in adults. By studying how the virus enters and damages the brain cells, researchers hope to find new ways to prevent and treat these conditions. Additionally, developing reliable and rapid diagnostic tests for Zika virus infection is essential for early detection and intervention. Currently, the diagnosis of Zika virus infection is based on blood or urine tests, that detect the presence of viral RNA or antibodies. However, these tests have limitations, such as cross-reactivity with other flaviviruses, low sensitivity, and high cost. Therefore, researchers are working on developing novel methods, such as biosensors, nanotechnology, and CRISPR-based tools, that can provide accurate and affordable diagnosis of Zika virus infection. Moreover, educating and empowering the public about the risks and prevention of Zika virus infection is vital for reducing transmission. People who live in or travel to areas where the Zika virus is endemic should be aware of the symptoms, modes of transmission, and potential complications of the infection. They should also take preventive measures, such as using insect repellents, wearing long-sleeved clothing, sleeping under mosquito nets, and avoiding unprotected sex with a partner who has or may have the infection. However, it's important to note that these strategies require sustained efforts over the long term, and collaboration among international communities is essential to effectively address Zika fever.
Dr. Mihiraa, your insights have been incredibly enlightening. We greatly appreciate your time and expertise today.
Now, look at Extract 2. Extract 2. Questions 37 to 42. You hear a psychologist called Mihiraa giving a presentation to a group of medical students. You now have 90 seconds to read questions 37 to 42. Why is effective communication with patients important? Hello, I'm Dr. Mihiraa, a psychologist here at the University Hospital. Today, I'd like to emphasize the significance of communication in patient care by sharing a compelling case study. Before delving into that, let's briefly explore the field of psychology and its role in promoting patients' well-being. Psychologists, like myself, are dedicated to understanding and enhancing individuals' mental health and emotional resilience. We utilize a range of therapeutic techniques to support patients of all ages in coping with challenges, improving their mental clarity, and achieving personal growth. Our approach is centered around creating a safe and empathetic space for patients to explore their thoughts, feelings, and behaviors. While doctors often begin with what physical symptoms are you experiencing? My initial question is how are you feeling, and what thoughts are on your mind? Now, let's proceed to the case study. This case revolves around a patient named Sarah, a 35-year-old woman, who experienced a traumatic car accident. Thankfully, Sarah survived the incident, but she emerged from it with emotional scars that were just as significant as her physical injuries. When I first met Sarah, several weeks after the accident, she was struggling not only with physical pain, but also with overwhelming feelings of fear, anxiety, and guilt. The accident shattered her sense of safety and control, leaving her emotionally vulnerable. Surprisingly, Sarah exhibited resistance to engaging in therapy. Some medical professionals believed that if she was unwilling to participate, there was little they could do. However, I held a different perspective. Recognizing the importance of building trust and rapport, I focused on establishing a genuine connection with Sarah. I aimed to create an environment where she could share her thoughts and emotions without judgment. Rather than immediately delving into the traumatic event, I started by exploring her interests, hobbies, and daily routines. By understanding her as a whole person, I aimed to lay the foundation for a meaningful therapeutic journey. So, how did this therapeutic approach impact Sarah's recovery? We began with simple exercises to help her manage anxiety, such as deep breathing and mindfulness techniques. These strategies provided her with tools to navigate her intense emotions. Sarah's resilience became evident when she applied these techniques during moments of distress. Over time, as she grew more comfortable, we gradually addressed the trauma she experienced. Sarah's progress wasn't linear, and there were times when she felt overwhelmed. Yet, our ongoing communication and collaborative approach allowed her to develop healthy coping mechanisms. Sarah continued therapy for several months, experiencing both breakthroughs and setbacks. One significant milestone was when she could discuss the accident without spiraling into anxiety. Although it wasn't a complete resolution, the ability to talk about her experience marked a crucial step in her healing process. The journey wasn't without challenges, but moments like these propelled Sarah forward. Her newfound ability to confront her trauma empowered her to envision a future where she could regain control over her emotions and live a fulfilling life. The positive outcome of Sarah's case underscores the importance of effective communication in psychology. Patient-centered care, where communication is compassionate and tailored to individual needs, can significantly impact the therapeutic process. By fostering trust, understanding, and collaboration, psychologists can guide patients on a path toward emotional well-being and personal growth. That is the end of Part C. You now have 2 minutes to check your answers.